In this video, we'll break down the key differences between CT slice thickness and collimator width, two terms that are often confused yet essential to understand for accurate imaging. We'll also look at how detector width fits into the picture and what determines your ability to reconstruct slices of various thicknesses. Let's start with collimator width. This refers to the total width of the X-ray beam used to scan the patient during each rotation. It's calculated by multiplying the number of detector rows by the width of each individual detector. For example, with 16 detector rows that are each 1.25 mm wide, the total collimator width is 16 times 1.25, which equals to 20 mm. This 20 mm represents the width of tissue irradiated in a single pass. Next, let's talk about slice thickness. The thickness of each image slice reconstructed from the raw scan data. Slice thickness does not have to match detector width. You can reconstruct thicker slices by combining data from multiple detector rows. For example, with 1.25 mm detectors, you can reconstruct slices at 2.5 mm, 5 mm, and so on. Thicker slices reduce image noise, but also reduce Z-axis resolution. However, you cannot reconstruct slices thinner than the detector width. So in this case, nothing thinner than 1.25 mm is possible. This diagram helps visualize the concepts. At the top, we have 16 detector rows, each 1.25 mm wide, resulting in a total collimator width of 20 mm. Below are three reconstruction options: a 1.25 mm slice using individual detector rows, the thinnest possible; a 2.5 mm slice by combining two rows; a 5 mm slice by combining four rows. The takeaway here: you can go thicker by combining rows, but you can't go thinner than the detector element itself. Some scanners are designed with thinner inner detector rows and thicker outer rows. In those systems, when high Z resolution is needed, only the inner detector rows are activated during scanning. In such cases, the effective collimator width may be smaller than the full detector array. Let's recap. Collimator width defines how much tissue is scanned per rotation. Detector width determines the minimum slice thickness. Thicker slices can be reconstructed by grouping adjacent detector rows. Thinner slices than the detector width are not possible. And finally, slice thickness, detector width, and collimator width are not the same. Understanding these differences is key for optimizing image quality and managing radiation dose. Thank you for watching. See you next time. Bye.